In many communities, people trust the uniform without questioning the credentials, and that trust can be very dangerous.
We've heard reports of deaths attributed to alleged negligence of health caregivers, but the Ministry of Health and Social Welfare is warning that this has to stop as it flags off Operation Show Your Valid License and Certificate.
The state chapter of the Nigerian Medical Association has cried foul over the proliferation of fake medical professionals, as they call on residents to collaborate with the medical authorities to expose the fake doctors and unregistered health facilities operating across the state.
In Nigeria today, when most people walk into a clinic or a maternity center, they rarely ask one important question. Is this person treating me actually a qualified nurse?
So many quacks around the corner, and they portray themselves as nurses, but they are not. They are quacks.
Because in some cases, the answer may be no. This is Vital Signs Podcast, and today we are investigating a growing and dangerous problem in Nigeria healthcare system: quack nurses.
Over 1 million women and children, including 241,000 newborn babies, die annually in Nigeria from preventable causes. To reduce these statistics and discourage patronage of unskilled birth attendants,
these are people who present themselves as nurses without the proper training, license, or registration from the Nursing and Midwifery Council of Nigeria, which is the governing council of Nigeria Nursing and Midwifery Practice. They wear the uniform, they run the clinics, some even open maternity homes, and some also work in hospitals as surgeons or doctors. But behind the uniform, many may have no formal nursing education at all. Across Nigeria, authorities have shut down illegal facilities run by these so-called nurses. Some were found performing procedures they were never trained to. This is sad to hear and awful. Administering injection, conducting deliveries, prescribing medications, procedures that require years of professional training. And when complications happen, severe bleeding, infection, newborn distress, patients are rushed into real hospitals too late. I know a lot of people that have lost their lives due to this. Part of the answer lies in Nigeria's shortage of healthcare workers. When there aren't enough qualified nurses and midwives, gaps appear in this system. And where there are gaps, someone fills them. This is why I ask every time I go to a clinic, are you a qualified nurse? Are you a qualified doctor? This is Vital Signs Podcast. And in healthcare system, the most urgent question is not how to treat diseases, but the illusion of care. Thank you.
If you've enjoyed this episode of Vital Signs Podcast, kindly like, share, comment, subscribe, and don't forget to turn on your post notification button. Thank you.